This next module is going to take a look at the medical component of what LifePlan does. In this module, you're going to meet our medical director, Dr. Ashton, and you'll also hear from both Kathy Wellen and Kristen Ross, who are medical team members here at LifePlan. There's going to be a lot of information that's medical, just to kind of give you a background of some of the things that we cover, like STIs and prenatal development. Keep in mind as you're watching this that it is a lot of information, and the reason we're doing it is so that you can just have kind of an understanding of what goes on. But those of you that aren't medical team members, you're not going to ever be doing medical related things. You might be sharing information with your clients, but you won't be giving diagnosis or advice, and we're going to talk a little bit about what that is at the end of this session. But it's still important for you to be aware of what we do at LifePlan when it comes to the medical area. So sit back, take some notes on stuff, get a few things of knowledge from this module, and join us for our medical component.
Hi, my name is Michelle Ashton. I'm an OBGYN physician here practicing in St. Joseph with South Shore Women's Health Care. I'm board certified OBGYN, and I am also the medical director of LifePlan. This volunteer training, I know, is for both the volunteers that are on the medical side and on the non-medical, the counseling side as well. But I just want to make sure that you guys all know me and know who I am and know the role I play at LifePlan. Particularly on the medical side, anything that we do that is considered a medical procedure, from ultrasounds to providing vitamins or prenatal vitamins, even over-the-counter things, performing pregnancy tests, performing sexually transmitted infection testing, or giving any kind of advice that could be construed as medical advice, can only be done in this medical clinic because it's under my medical license. So I am the licensed provider that the state of Michigan recognizes as the one responsible for anything medical that happens here. So I'm excited to be able to do that because I think what's happening here is really great stuff. Women are hearing about the gospel. Women are getting cared for during vulnerable times in their life by people who love them and by people who want good for them. And that's who all of you guys are here at LifePlan. But I also just wanted to make sure that you understand some of the legal implications and some of the medical implications of all this, that things that might seem sort of innocuous when you're talking to your friends or your teenage kids' friends at home, simple advice or things like that. When you're at LifePlan, this is a medical clinic, and anything that's done here is done under the umbrella of my medical license and of the medical liability that we carry here as LifePlan. So just a reminder that we want to do everything that we do really excellently, and we want to do it professionally, and I'm happy to be able to be part of doing that. I think it's important that we do what we do medically at LifePlan with excellence for several reasons. First, because it's what our patients and our clients deserve. They deserve the best because they're created in the image of God, and they need to get the best healthcare that they can get. We also want to represent the gospel well by just doing what we do for excellence. Scripture tells us, whatever you do, work at it with all your heart as working for the Lord, not for men. And so we want to do our service here at LifePlan in that way. But then we also live in a world of rules and laws and that kind of stuff. And we want to make sure that we're also doing what we do, that everything's always legal and done in an appropriate medical way, and that it can be done in a way that's sort of above reproach for people that would criticize organizations like LifePlan and say that what we're doing is not really healthcare, or that we're deceiving our patients, that we are doing more medical things than we really are. We want to just always do what we do above reproach, and that comes down to things like respecting confidentiality and patient privacy, handling the medical records with confidential ways, and following the HIPAA laws and all those types of things. So I just wanted to pop into your training here for a little bit and say hi, let you know who I am, tell you thank you for what you do here. It's a really important and really meaningful thing to do for women. I would say, I've spent my career spending a lot of time talking to women that have been through various different situations with being pregnant, and the difference between having someone come alongside of you and say, you can do this, I'm here to help you, and I will encourage you and I will walk with you, can really be a huge difference in someone's life for decades to come and for generations to come. So thank you for being that person for women who need it. And thanks for doing it in a way that is excellent and reflects well on both LifePlan and on the gospel of Jesus Christ. Thank you.
Hi there, I'm Kathy Wellen, and I'm the nurse director at LifePlan. And today we're going to talk a little bit about our STI clinic. You know, every ministry at LifePlan is founded on our mission statement of helping people choose life and live hope-filled lives. We're able to accomplish this by sharing the gospel with our patients. We saw opening an STI clinic to be a way to broaden the scope of our services here and to give us a platform to share the gospel with more people. When LifePlan began several years ago, we had a narrower focus of helping moms in crisis pregnancies. But the more we ministered to this population, the more we realized there was a root problem that needed to be addressed so they would not end up in that crisis. We saw the need to point people to Christ in their brokenness in the area of sexuality. The STI clinic allows us to bring people to LifePlan who have a physical need in order to meet a deeper need of the healing of their spirits through the gospel message. I really see God's timing in when we opened our clinic in May of 2021. It was the same time that the pandemic was coming to a close. And at that time, the local health departments, who normally play a major role in the battle with this health issue, they had their focus shifted from STI onto the pandemic. That opened a door for us to step in and offer these services free and meet a great need in the community, especially spiritually, as other healthcare providers generally don't address that area of their patients' lives. Right now, we offer a urine test for chlamydia and gonorrhea, and we also offer a screening for HIV through a finger stick. We hope to offer a test for syphilis in the near future that will be combined with the HIV finger stick. This will be especially helpful with a great increase of syphilis and congenital syphilis cases in our area. You know, over half of the new STI cases are seen in 15 to 24-year-olds, and that's the main age group that we see at LifePlan. This is the age group engaging in unhealthy sexual practices that can lead to serious health issues. STIs often don't have symptoms, so people are spreading infections without knowing it. If left untreated, STIs can lead to a higher risk of getting HIV. They can cause chronic pelvic pain. They can have patients can have pelvic inflammatory disease, infertility, and certain cancers. Syphilis in pregnancy can lead to severe health issues in infants and even death. The first infection that we test for is chlamydia, and that's a bacterial infection of the genital tract, but it can also be infecting of the eyes, the throat, and the anus. And it's very hard to detect in the early stages. Symptoms may appear about 3 weeks after exposure, and often they're mild and they improve quickly. Some of the symptoms may include painful urination, vaginal discharge in women, discharge from the penis in men, pain during sexual intercourse, bleeding between menstrual periods, and testicular pain in men. The treatment is pretty simple, thankfully. We will give a patient azithromycin, 1 gram orally in a single dose. And at our clinic, we mostly use that for pregnant women because they cannot have doxycycline, which is the alternate treatment. And for doxycycline, we give 100 milligrams orally, and that's given twice a day for a week. And there's a lot of stipulations when giving doxycycline, so patients need to be taught not to take it with dairy products, as that interferes with the absorption of the medication. And it can also make people, doxycycline can make people more sensitive to the sun. The other thing is that patients need to be told that they can't lie down for a half an hour after taking this medication, as it can cause problems with your esophagus. You can have ulcerations. So there's a good bit of teaching with our patients with that medication. The second infection that we treat for is gonorrhea. and it is also a bacterial infection of the genital tract, and it also can grow in the mouth, the throat, the eyes, the anus, and the joints. And symptoms usually appear about 10 days after someone is exposed to gonorrhea. However, a person may be infected for months without any signs or symptoms. The signs and symptoms that a person may notice are a thick, cloudy, bloody discharge from the vagina or penis, pain and burning with urination, heavy menstrual bleeding or bleeding between periods, or bleeding after intercourse. A man can experience painful swollen testicles. There can be painful bowel movements, and also if it's involving the rectum, there can be anal itching. Treatment for gonorrhea is a single dose of 500 milligrams of Rocephin, and that's given IM, that's intramuscularly, and so that's just a one-time treatment. The final test that we do is for HIV, which is short for human immunodeficiency virus, and that is a virus that damages a person's immune system, making it difficult to fight infection. And usually within 2 to 4 weeks of exposure to HIV, a person may experience flu-like symptoms, and the symptoms may be so mild that a person may not even notice them. But as the virus continues to attack the immune system, a person may experience more chronic signs and symptoms, such as a fever, fatigue, swollen lymph nodes, diarrhea, weight loss. A person can come up with shingles or pneumonia. And when left untreated, HIV can become AIDS, and that usually happens in about 8 to 10 years. So unfortunately, there's no cure for HIV, but there are medications that patients can take to control that. And if a patient tests positive for HIV, we're able to connect them with local resources where they can get help. And this is a really difficult diagnosis for someone to receive, so we need to be prepared to show them great compassion and concern, and we really need to be able to assist them to walk through that diagnosis. I'd love to share what the patient will experience when they come in to get an STI. So the first thing is they come in, we get a copy of their identification, we give them an STI intake form. They sign our HIPAA signature form, and then we also have them fill out a sexual health inventory form, and that gives us a little sense of what their practices sexually, what they've experienced. Is very general and short, and at the same time we'll give them what we call an Sti Questionnaire, and that is basically a true-false test just to get an idea of their knowledge about these infections and what they believe about how these infections are transmitted. We offer all 3 tests to the patient when they come in, and one of the things, if they decline the HIV test, they need to sign a declination form for that. So that pretty much finishes the paperwork when they come in, and at that point the patient gives us a urine specimen for chlamydia and the gonorrhea test, and then we run a HIV screening with blood from a finger stick, and that takes about 15 minutes for the results to come. The chlamydia and gonorrhea test, we package those up and send them to a lab, but the HIV screening, we're able to give them the results on site at LifePlan. And as I said, it takes about 15 minutes for the results to appear. So that's a really good time to go through the STI questionnaire with them, and just we can teach them the health risks related to sexual behaviors, and it's a good time to ask the client about their spiritual beliefs, teaching them that sexual behavior not only affects their physical health, but also their emotional and spiritual health. And before they leave the appointment, we make another appointment for them to come back and receive their results. And at that time, we can pray with them and just send them on their way. And the good thing about it is that we have that next appointment, and it really gives an opportunity to think through maybe what the client has shared with us, whether it's physical practices that aren't healthy, or something that they've said spiritually. One of the good things about our STI intake is that we ask them, what are their spiritual beliefs, and they can say what faith they are a part of, and they also, do they desire to have a better relationship, or if they're not interested. And that's one of the things I check pretty much maybe when they go in to use the restroom. That's kind of keys me to go look and see where they are spiritually, so I can, in the back of my mind, be thinking about how I could interject that spiritual conversation with them. If someone was interested in getting more information about STIs, or just being more prepared to have those kind of conversations with their patient or their client, I would really suggest going to the Mayo Clinic. You can Google Mayo Clinic and STIs. They're very concise and clear, especially if you're not medically minded. It's pretty simple, so that's a really good resource. Another good resource is the CDC's website. That's a little bit more medical and a little bit more overwhelming to someone who's not familiar with a lot of medical language, but both of those sites are really good. Another thing that is available to the volunteers at LifePlan is our Bright course. And one of the best things that you can do to be prepared for those conversations with your clients is to watch the share videos done by Pam Stencil on Bright course. And that is extremely helpful. She goes into probably more thoroughly a lot of the things that I shared today, and a lot more about the relationship part of STIs. So I would really suggest that those are some good resources to look up.
Hi, my name is Kristen Ross. I am a volunteer nurse at LifePlan, and today we're going to be going through the developmental stages of the baby from week 0 through 20. A couple of things I want to encourage you to do. I am going to go through a lot of information, so I do want you to choose just 1 or 2 things that you find interesting, and those are the things that you'll decide to remember and take with you. I will also be talking about the different stages of development, so you'll hear terms like zygote, embryo, and fetus. Know that those are just stages of development of the baby in the womb. And then just for simplicity's sake, you'll hear me refer to the baby as her. Please note that the information that you'll hear here is from Cleveland Clinic, Mayo Clinic, and then also Baby Center. So week 2 is where we are going to start. This is ovulation. And so the women, we actually determine when pregnancy starts 2 weeks before this, at the first day of her period. So the egg is fertilized 12 to 24 hours later by just one of 250 million sperm that are attempting to penetrate the egg. And this simple biological occurrence begins a series of increasingly complicated processes that lead to a new human life. So over the next several days, the fertilized egg will start dividing rapidly into multiple cells as it travels down the fallopian tube and enters the mom's uterus. The baby's sex is set at conception depending on whether the sperm carries a Y chromosome or an X chromosome, and then boys and girls' genitals will look the same until around 9 weeks. So week 3 is when implantation occurs. The developing baby is currently a tiny ball of rapidly multiplying cells. And the cells in the middle will become the embryo, while the cells on the outside will become the placenta, which will supply nutrients and oxygen to the baby. Baby travels down the fallopian tube and starts to implant itself in the lining of mom's uterus. And the pregnancy hormone at this time, it's called HCG, and it's being produced by those outer layer of cells, which will become the placenta. This is the hormone used by pregnancy tests to determine whether mom is pregnant. So by the end of week 3, you might be able to get a positive test. So at week 4, baby is the size of a poppy seed. Mom's little ball of cells is now officially an embryo. And over the next 6 weeks, its nervous system, connective tissue, and organs will start to develop. You're now about 4 weeks from the beginning of your last period. If you took the pregnancy test a little too soon during week 3, you should be able to get a positive test on a home pregnancy test at this point. Now, this is the point in your pregnancy during which your baby will be most vulnerable to anything that might interfere with her development. So at week 5, the embryo is growing at a furious rate. The circulatory system is beginning to form, and the tiny heart will start to beat this week. Baby is the size of a sesame seed, and his or her brain, spinal cord, nerves, heart, and circulatory system are starting to develop. Though still quite primitive at this time, the placenta and umbilical cord are already on the job, delivering nourishment and oxygen to the forming baby. Week 6. So we've got our baby model for week 6 here. This baby is the size of a lentil. Her nose, mouth, and ears are starting to take shape, and the intestines and brain are beginning to develop. Her heart is beating around 160 times a minute, almost twice as fast as yours. Mom may be able to see it beating if she has an ultrasound at 8 weeks, or hear it with a Doppler around 10 to 12 weeks. There are dark spots where the eyes and nostrils are starting to form, and emerging earbuds are marked by small depressions on the sides of the head. Inside the tiny mouth, the tongue and vocal cords are beginning to develop, and the backbone extends into a small tail that will disappear within a few weeks. So at 7 weeks, baby is the size of a blueberry. She has doubled in size since last week, but still has a tail which will soon disappear. Little hands and feet that look more like paddles are emerging from the developing arms and legs, and her arms and leg buds are growing longer. Baby's eyes, nose, mouth, and ears are starting to look more defined, and the main parts of the eyes that allow baby to see start developing this week and are almost fully formed just a few weeks later. Baby's stomach and esophagus also start to form, as well as her liver and pancreas. So at 8 weeks, baby is the size of a kidney bean. She's started moving around, though mom won't feel any of her movement yet. Her respiratory system is now forming, and breathing tubes now extend from her throat to her developing lungs. Baby has fingers and toes now, and they're webbed. Her hands are flexed to the wrist and meet over her heart. She now has knees, and her legs may be long enough that her feet meet in front of her body. So at 9 weeks, baby has all of her essential body parts now, including elbows, knees, and other joints that can flex. She is now the size of a grape, and the 4 chambers of her heart have now formed. She even has tiny earlobes, but there's still much more to come. Her 10 tiny tooth buds are developing with each band of gums, and next week the teeth will start to harden and connect to the jaw. Her embryonic tail has disappeared, and though she weighs just a fraction of an ounce and is about 1 inch long from head to bottom, she is about to start gaining weight fast. At 10 weeks, mom's little embryo has completed the most crucial portion of development. She is now about the size of a kumquat. Her skin is still translucent, and the little details like nails are starting to form. Eyelids now cover her eyes, which will stay fused until about 27 weeks. Baby's forehead temporarily bulges with her developing brain and sits very high on her head, which measures half the length of her body. 10 weeks is my personal favorite time to get to watch prenatal ultrasounds because the baby just looks like a tiny little person with arms and legs. At 11 weeks, your baby is the size of a fig and almost fully formed. She is no longer called an embryo, as this week is the beginning of the fetal period. All vital organs should be in place and may have already started to function. Baby is now busy somersaulting and stretching, kicking, and even hiccuping as her diaphragm develops, although mom won't be able to feel any activity until around 16 weeks. So at 12 weeks, baby is the size of a lime, about 2¼ inches long, and weighs only ½ ounce. This week, baby's reflexes kick in. Her fingers and toes have lost the webbing, and now she will soon begin to open and close her fingers, curl her toes, and make sucky movements with her mouth. She can feel it if mom pokes her tummy, though mom still won't be able to feel her movements yet. Peach fuzz has also begun to grow on baby's tender skin. We're now at week 13. This is the last week of the first trimester. Baby is the size of a pea pod. Baby's tiny fingers now have fingerprints, and her veins and organs are clearly visible through her skin. If baby is a girl, her ovaries contain more than 2 million eggs. She has started swallowing and excreting urine, which she then swallows, recycles the full volume of fluid every few hours. And she's also producing a product called meconium, a black sticky substance which will accumulate in her bowels, and you'll see in her first diaper. We are now entering the second trimester. At this point, a miscarriage is much less likely for our mom to be. Early pregnancy symptoms like morning sickness and fatigue have likely faded away, and at 14 weeks, baby is the size of a lemon. Thanks to brain impulses, baby's facial muscles are getting a workout as her tiny features form one expression after another. Baby starts to make sucking and chewing movements, and you may catch her sucking her thumb during an ultrasound. Her body is now growing faster than her head, which now sits upon a distinct neck. And though mom can't feel her tiny pushes and kicks, or punches and kicks yet, little one's hands and feet are more flexible and active. So at week 15, baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. She's about 4 inches long, the size of an apple. If mom could see inside her womb right now, she might catch her baby sucking her thumb, yawning, stretching, and making faces. Baby's legs are growing longer than her arms now, and she can move all of her extremities. This active little baby is moving constantly, though mom still won't be able to feel it yet. Her eyelids are fused shut, but she can see light. So if mom shines a flashlight on her belly, baby will move away from the beam. In the next few weeks, baby will double her weight and add inches to her length. At week 16, she is now the size of an avocado. The patterning on baby's scalp has begun, though the hair isn't visible yet. Her head is more upright, and her ears are close to their final position. Mom will probably start feeling her kick between 16 and 22 weeks. Even this early on, talking to baby is a great way to start the bonding process. So at 17 weeks, the baby is the size of a turnip. Baby's skeleton is changing from soft cartilage to bone, and sweat glands are developing. The umbilical cord, her lifeline to the placenta, is growing stronger and thicker. Her blood vessels are visible through her skin, and there's no baby fat yet to plump her up. We're now to 18 weeks, and baby is the size of a bell pepper. She is flexing her arms and legs, and mom may be able to feel the movements. Baby's ears are now in the final position, although they're still standing out from her head a bit. In the lungs, bronchioles are starting to develop at the tips of the branches. At the end of these tiny tubes, respiratory sacs begin to appear. If mom is having a girl, the baby's uterus and fallopian tubes are formed and in place. If she's having a boy, genitals are noticeable now, but he may hide them from you during an ultrasound. At 19 weeks, baby is the size of an heirloom tomato, about 6 inches long, and she weighs approximately 8.5 ounces. Baby's sensory development is exploding. Her brain is designating specialized areas for smell, taste, hearing, vision, and touch. Mom and dad can talk, sing, or read out loud to her to begin the bonding process. The skin on baby's toes and fingers has buckled into distinct patterns that are now permanent and unique. A waxy protective coating called the vernix is forming on baby's skin to prevent it from pickling in the amniotic fluid. We have finally reached 20 weeks. Baby is the size of a banana and is 10 inches in length. We are halfway through pregnancy at this point. Baby can swallow now, and her digestive system is producing meconium, the dark sticky goo that she'll pass in her first stool, either in her diaper or in the womb during delivery. For the first half of pregnancy, when a baby's legs are curled up against her torso, measurements are taken from the top of her head to her bottom, or from crown to rump. But starting at 20 weeks, baby's legs have uncurled enough so that she is able to be measured from head to toe. Many of baby's taste buds can now transmit taste signals to her brain, and she's swallowing molecules of the food mom eats that have passed through her blood into her amniotic fluid. Researchers aren't sure if baby can taste these molecules, but some research indicates that what mom eats during pregnancy can influence the foods that baby will prefer later. Our baby has made amazing strides in her development and is well on her way to a healthy birth. Here at LifePlan, we offer lots of resources, one of which is ultrasound. So if you have a mom that comes in and has a positive pregnancy test, is in some sort of crisis, or is abortion-minded, then we highly recommend that you try and get them to come and have an ultrasound. We do recommend that they come in between 8 to 10 weeks. That is the ideal time frame to have an ultrasound done, but we will do it as late as 20 weeks, and if they are abortion-minded, as early as they need to in order to get them to come to LifePlan. Also, if you do have a mom that has a negative pregnancy test, whether it's positive or negative, we still recommend that you will refer them for STI testing.
Yes, since we're offering the STI testing now, it's a great opportunity to get moms to come in another time, and it's not costing them anything. Normally, the OB/GYN does a STI test for a mom at the first appointment, but a lot of times now they're not doing appointments as early as they used to. So that's a really good opportunity to get them to come in. So refer them for an STI test. And along with that, their partner can come in and get treated, because a lot of times moms can go to their OB and get tested and treated, but their boyfriends or partners don't have anybody, don't have a medical facility that they're connected with. So it's a good opportunity for them to come to us and get tested. And I think the other thing that comes to mind with this is that when you're with your clients, especially if you're not on the medical team, we need to be very careful about giving medical advice. A lot of times clients and patients will ask us, what should I do in this situation? So there's like a fine line between sharing information, teaching about health issues, and just giving them good information and giving them advice. And whenever you're in doubt, please refer them to the medical team. You can get a hold of me anytime, text me, and I will get back to you. And it's just a safer way to prevent that. It's always good to give handouts or maybe suggest a good resource site. And even with that, you might want to ask one of the medical teams, is this acceptable? So we just always want to be careful with that. And I think the other thing, a lot of times receptionists will get phone calls from other medical clinics or doctors, and we just need to make sure that we refer those to the medical team rather than trying to answer those questions when you're not 100% sure. So we just want to encourage that. Again, with this STI testing available, we want to have every opportunity to offer that to our clients. So whether they have a positive or negative pregnancy test, keep that in mind, that that's another opportunity to have them come in and have an opportunity to share Christ with them.
Congratulations, you have now completed this module. Please meet with your staff member or shift leader to discuss what you have learned.